My name's Gerry Taniane. I'm an audiometrist. I've been working in this field now for 40 years. You'll see audiometrists and audiologists on the paperwork. Audiometrists usually have a lot more training on the job. Audiologists have gone through a lot more college work. But both of them can do this sort of work for you. A person with diabetes is twice as likely to have a hearing loss. So it's important that they do check their hearing regularly. Most people with hearing loss will actually have problems understanding what's being said, don't hear what's being said. So often when they're sitting in a consultation with a doctor or a medical advisor or an allied health professional of any description, they will have a problem picking up the difference between certain words. Now that could be crucial to their treatment. Diabetes affects the nerves. You get neuropathy of the nerves, which is a damage of the nerves. So the hearing nerve itself is in the cochlea, and damage to that reduces your ability to understand speech. So we have old age causes it as well. So, in a couple of years' time, I'll start to have a problem. We have noise-induced hearing loss, and now we've got pretty good evidence that diabetes is also affecting the nerve, which means that people are losing their ability to understand speech. Again, we keep going back to that but you add someone who's older, worked in noise and got diabetes, well then he's got 3 triggers that are going to cause the problem. So people with this sort of hearing loss tend to mix up words, misunderstand words. Sounds like F, S, TH become difficult to distinguish between. Testing hearing testing can take as little as half an hour. So it's only a half an hour out of your time to get a full hearing test done and find out exactly what's wrong. Then you can talk to your hearing care provider, your audiometrist, your audiologist, about what steps you can take for better communication. That may require hearing aids. It may just require a little bit of training on how to communicate. Simple things like sit with the light on the face of the person that you're listening to rather than have the light behind them. You want clear picture, and family and friends can do the same thing. If you're talking to someone with a hearing problem, don't put your hand over your mouth like that. Don't turn your back and walk away. Sit there and talk to them, because that will help them. So the best idea is to have your hearing checked probably every 1 to 2 years, or if they notice any significant change in their hearing.